Sandeep will share the testimony, whether we can go ahead.
Yeah, hi everyone. Hope you are doing well and safe. So I'm Sandeep. I'm from Jaipur, India. Last year in August, I was diagnosed with a condition called secondary polycythemia. So in this condition, the hemoglobin levels are increased due to not proper functioning of bone marrow or like any second reason which are unknown. So we doctor was not able to find out the reasons why it's happening, but the treatment was every month I have to go for a phlebotomy, basically blood removal from my body around 300 ml to 400 ml, so that we can keep the hemoglobin level decrease. And they also suggested me to go for blood thinners because once hemoglobin level increases in the body, your blood becomes thick and there the chances of blood clotting or thrombotic events increases. So I was in the dilemma, like I was already doing the phlebotomy from August to January, like almost 6 7 times. But to start with the blood thinner, I was little hesitant because once you start blood thinners, like you have to continue lifelong. Then I got to know about Dr. Banu from my manager. He introduced me to Miss Revati Bose, who is one of the instructor and here, and I joined the session and started following the advices as suggested. So I start. So then first I went for the checkup of vitamin D and vitamin B12 levels in my body, including the health checkup. So we found out like vitamin D level was very low, like less than 25. Then I started with like doses of vitamin D, like every 3 hours, 60 IU, every 1 hour, then 3 hour, and gradually reducing to like maintenance dose, like 1 week, once per week, over the period of time. Along with that, I also took supplements, vitamin C, benofithamine, and other supplements as Dr. Banu suggests, vitamin K, and also collagen supplements. Yeah, and apart from that, most importantly, I switched from the normal salt to the pink salt and also started taking the lime water, like 1 liter of lime water mixed with pink salt over the time during the day hours. And apart from that, also the bone soups, which is very important. Like I was like initially like my non-veg diet was like I used to take it once in a week or something, only chicken, but uh, from the suggestion I got, I started taking it like very often, like bone soups almost thrice a day. Uh, so which helps like in the proper bone marrow function. Like if you take bone soups, the mutton, like so. After taking all those things and incorporating in my life, I'm happy to say that since February, I started this in February, like in the end of February, and till now I haven't gone for any phlebotomy event. Like my hemoglobin levels are under control, and not only that, I also feel more energetic and improvement in my physical health. Like previously, I had issues with uh, like almost every time I used to get gastric issues, acidities. These were pretty common. But after like including these things, right, I don't feel that anymore, and also I'm comfortable having non-veg quite often as well. And I reduced wheat from my diet. Like previously I used to take 3 4 rotis in a like 1 day per day, but now I have reduced to one. I have shifted to the millets or avoid taking wheat at like almost like very less. So yeah, I want to thank to Miss Revati Bose and Dr. Bhanu for introducing me to these lifestyle changes and helping me in treating my disease. And yeah, so thank you very much. Uh,
Yeah. Thank you, brother. So next, anybody want to, or Ravati, boss, you want to add anything to this? So let me make you co-host. Yeah, sister, if you want to add, you can.
Yeah. So when he shared it with my husband in the office that he had these issues, when he was willing, then he spoke to me, and he was willing to follow what we say. And we started seeing tremendous changes in his health, especially from gastric issues. Um, Especially from gastric issues and other things, because he had earlier done endoscopies and all for his gastric issues. So whatever medications we told, no, you should not be taking it. And just with salt water, apple cider vinegar, and the diet changes. See, basically, he's more inclined to a very veg diet. He's more inclined to a very, very veg diet. So we had to explain to him how important is the bone soups and how often he is supposed to increase his protein intake. And since he's basically from a North India, more inclined to wheat kind of products, so he cut down all almost, and then he started uh, taking more of non-veg soups. And see, he's a bachelor. I would encourage that only because he, though being a bachelor, staying in the room in Gachibowli here. When I told, he used to walk down to mutton shops every day to get the bones to, cook and drink. So I really appreciate his effort that he took to do all these things. And over a period of time, he started seeing a lot of changes, and his health also improved. And since the time he joined with us, he never went for even one time also. He never went for giving of blood. So that is the thing of that. And also, is his he started now guiding his parents and and his family members. So that's a real thing, a real good thing. Yeah. Thank you, and thank you,
Yeah,
Dr. Banu, for guiding. And Dr. Banu used to we used to ask suggestions for the D3 doses. Dr. Banu used to guide how to go about. So, thank you so much, Doctor.
yeah. Thank you, sister. So, yeah, next, anyone want to share the testimony? Who will go next?
Good morning to Dr. Panas
Ramya
and
wants
his
to share testimony, brother. Ramya
Ramya.
Chintapalli.
Okay, right. So, Sister Rani, you're going to share the
yeah
testimony?
yeah yeah
Yeah, after
uh,
me, we'll ask Ramya to share. I think with that, we'll conclude with the testimonies. Yeah, go ahead, sister.
yeah I'm Elizabeth Rani, aged 60 years. I was a diabetic from 39. At the age of 39, during my pregnancy, I got this diabetes, but it was continued like anything, but I could not recognize it. I thought it is a gestational diabetes, it will go, but it continued in my body. And sometimes I have a very up and downs in my diabetic stages. So I used to go to doctor and they used to take medicine, but nothing happened. After that, means that levels used to increase, decrease, and that is the way my system worked. After some time, uh, I have taken for naturopathy treatment, only vegetarian diet. I underwent that 1 or 2 months, not even 3 months, but my weight has come down to 40. In the span of 2 months, I was 48 when I started this naturopathy treatment. My weight has come down to 40. So I stopped that treatment, and I used to think my body has become very lean, and dryness, hair falling. Uh, these things are very sleeplessness, and so many things are happened in my body. Then my brother introduced this. You joined in CRT. They are telling about the food, and that will be about biblical and all, how our body was made by God in that way, that telling us about this. Then I joined this CRT team at the end of June month and all. Then they told me to go for a D vitamin test. Sister Indira gave me advice, and she also encouraged, madam, these things are there, means no, 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 madam, be patient, you will be okay, do this, do this. So in that way I have followed it, and I have started with, for me, constipation problem, I started with salt water, and that was completely gone. But sometime I have taken some contaminated water, so it was a little bit problem for me now. Not only that, I have started using all these things, non-vegetarian food. I thought it is not good to eat non-veg continuously or like that, because I was on the vegetarian diet. So I thought in that way, but after taking this non-vegetarian diet, and following all the instructions, advices given by Sister Indira, I could first, when I started this program, this health program, my diabetes was about fasting. It was about 240, 248, and PP will be around 300. Like that it was. But after using this, my D vitamin has increased from 12 to 120. And my skin has become somewhat supple, because it was so much dry. Even my hands, if I want to open any bottles also, my hands used to be so much dryness, that I could not able to open the lid also. Now it has my hands, my legs, my skin somewhat suffered, because really collagen made me a miracle. Taking the collagen powder, really my body has become supple, my hair fall has come down, and my uh, constipation, dryness, sleeplessness. After taking magnesium, I never used to sleep properly. But after taking this magnesium, I am sleeping just like a dead body like that. I am getting a very good sleep. Really, I thank. There are so many changes in my body. Testosterone, that was very less in my body. I'm taking the supplements. Next, some means muscle is forming in my body, and benthothiamine. Uh, these things, vitamin C, and all, when I'm taking this, really I find a lot of change, 100% of change in my body, the functioning, the skin level, the hair, everything has again started. I'm regaining all these things from my body. Really, I thank Dr. Bono and team, especially Sister Indira. So now I am all right. Now my this sugar has come down to 95. It used to be sometimes 600, above 600 previously, but it has become 95%. And my HB1AC will be 1150, like that. It has come down to 850. Until longer, more than 1 month it is over. I have not tested. And many other things were changed in my body. Really, I was benefited, and I praise God using Banu brother to guide all of us in this. Thank you.
Yeah, thank you, sister. So it's really a wonderful
Okay,
Uh,
Prakash, just a moment.
yeah.
Sister, thank you so much for sharing. Well, I would not use the expression sleeping like a dead body. I would use the expression sleeping like a baby. So that's
Yeah,
wonderful.
yeah,
And
yeah, yeah.
also, yeah, and
Okay,
also,
thank you.
I think what is it? The fasting sugar is 240, 250, 300 to a point where you're able to have normal blood sugar levels within a span of a month and a half, 2 months is just remarkable. And also getting your HbA1c from 11.5 to 8.5, coming down to those levels in a matter of less than 2 months is remarkable as well. And that cannot be done by any medication. It is impossible. It is impossible. So yeah. So thank you so much. I think this proves the point that diet has diabetes is a lifestyle disease, and if you're willing to change your life and your lifestyle, diabetes can be overcome completely. Thank you.
Yeah.
Yes, brother, it's miracle. The way
Maybe sister.
vitamins, the
Yeah. So
okay.
why don't you share, per day, how you are taking the supplements and how much quantity that you are taking.
And also, before doing that, just a moment. What is your weight now, sister?
Now it has come to 46, brother. At a
Okay,
40,
so
from 40
from
to
40
46.
kgs to 46. Okay, okay.
Yeah,
And you feel a lot better. You have more energy,
yeah.
right?
More
Okay.
energy. Not only that, I used to be very skinny that time
Hmm.
and very
Hmm.
dryness everywhere. My skin, legs, everything were very dry. Now it has
Okay.
becoming good.
Okay. Sister, how old are you?
I'm 60 years, brother.
60 years. Wonderful. Okay. Yeah. And yeah, you can share what Prakash asked you to share. Thank you.
Okay, brother. Thank you.
Yeah, you can share, how you have taken supplements, at least you take one day
Uh,
and from morning to evening. So how much quantity you take each supplement?
uh, means first I have taken D when it was 12, only 12% in my body. Then I started taking vitamin D for 2 hours, one tablet. Means nearly 10, like that. The first I have taken for 1 week or like that. Next, I have, as per the schedule, I have taken. And next, I have taken, first time I brought only benfotiamine and next collagen. These two main starting, I have used only these two. Water, I have to take 1 liter salt water, 1 liter lime water, 1 liter coconut water, and buttermilk 1 liter. Yes, sometimes it varied, not continuously. Sometimes if I get, because I am staying in Orissa, I may not get this coconut water there and all. So like this, I have corrected my water levels, liquids
Yeah.
I have corrected. After that, being vegetarian for 3 months, complete vegetarian. Again, I came into the non-veg diet, taking slowly eggs, chicken, mutton, and taking some soups, mutton soup, and all. Next, I have added, as I am very skinny and all, my muscle was lost. I have added this testosterone also. That also helped me. Mainly, I think after taking collagen, a lot of change has appeared because hair fall used to be more. So this collagen helped me more, and my skin was very cold and all. That also it helped. My skin also became somewhat better than before. So I'm continuing it.
How many times you have taken, sister, collagen and
Two
benfotiamine?
times I used to take a
Right.
benfotiamine. 3 times I used to take, brother.
Right.
Yeah.
Okay. So only these supplements and that food.
Now I have
Yeah.
increased CoQ10, so many other things. Just now I have increased it now.
Okay.
I have to
Okay.
see how the changes will take place.
Okay. Yeah. Thank you.
Uh,
So I think we are on top of the hour. So what we will do is Sister Ramya will share testimony next week. Um, so please, be prepared with the reports and all if possible.
Oh no, Prakash, let her share. Let her share.
Okay.
I have a few minutes. Let her share.
Yeah. Yeah. Sister Ramya, you can share. Okay. Yeah. Yeah, Sister Ramya, you're there?
Yes, Anna, I'm here.
Yeah. Yeah.
Good,
Please.
good morning to all the Wellsprings and namaste to Banu uncle. So I'm Ramya, originally from Guntur, but right now I'm staying at Chennai, Tambaram. So we moved here in the year of 2022 as my husband was appointed here with an MNC. So basically, we were introduced to the CRT group, which is now the Wellsprings in the year of 2020. But due to various other reasons, we couldn't follow much, or we could say we remained ignorant. But right now, my testimony would go a little longer. Would it be fine if I had to cover a lot of details? Would it be fine, Anna?
Um,
If it's fine, I would go on. Otherwise, I would really share. I could come like next week.
yeah. Anna, that's what I mean. I'm thinking like a little detailed testimony. I think next time we'll
Yeah,
give some.
yeah. We just
Uh,
briefly share, Amma. We will, we'll do the detailed testimony next week.
yeah, that would be better. Yeah.
Okay, okay. So right now I'm aged 40 years, but little I would go to my childhood days. So I had always faced the cough and cold along with the phlegm. So for most of the seasons, I would be like with fevers and all. So later on, after I attained the puberty age, I this condition worsened to the sinusitis. So as I was growing in my years, I faced again the gum related problem also, wherein I had to undergo several flap surgeries of my teeth. So my gums used to bleed, and then they became weaker and looser at some point. So it happened like there was no cure for all this. So it went on and on like this. Then later on, when I was working into Bangalore in 2009, first I faced the problem of this continuous motions. It would be watery, it would be loose, which I didn't understand the cause behind it. So, a suggestion by doctor or local RMP, I started to carry Cestil AD, which stopped my motions immediately in my purse. So wherever I went, I used to carry the Cestil AD tablet. So fast forward moving to 2014. So I had happened to conceive my first child. So then I was diagnosed with Hashimoto's autoimmune disorder, which is thyroid related. So my anti-TPO levels were almost up to 600. So almost I was spotting and bleeding in my fourth month, which was because of this thyroid. It was severe thyroid. So the doctor put me said that you have to be lifelong thyroxine. But really, the Lord helped me to have the safe delivery during that time. Then in 2017, when I was carrying my second child, so this problem of motions worsened much. So the same time I faced ear infection, and then almost in my ninth month, I had almost this motions went on for overnight and a whole day. I lost the count, but my OBGYN asked me to admit for drips. I totally refused it, and it only stopped after using a medicine. Then on November 20, 2017, I delivered my second daughter. But then I had discharged with a severe headache. So on 24th of the same month, 2017, early in the morning, I became I lost my vision, and then I had a severe eclampsia, which is seizures twice. So I ended up in ICU. So from then, though I came out of the hospital, I never felt the same. So my energy levels grew down. Uh, so I became all the more weak, and was tired very easily upon doing small things also. So my finger bones used to pain suddenly, all of a sudden, and I had chest pain during nights. So I had to push myself even for small daily chores in my household. So I used to even have a peculiar pain in my back, which I blamed because this is due to my sleep posture. I had lower back pain and leg pain and the cramps during my monthly cycle, which were really unbearable. At one point, I couldn't even weigh my own two-wheeler many times. So I was falling away, and my health was deteriorating. Later on in 2020, so my sinusitis again worsened. So I was coughing whole night. I was sneezing blood, and I was coughing with. I was taking out the phlegm with blood. There was sleepless nights. My children also were affected the same time. So we had shown ourselves in ENT at Guntur. Then he suggested some extra bone had grown in in your nose. You have to undergo a surgery. So which we agreed, and we had undergone that surgery. So even after surgery, there is no improvement, there is no betterment which I felt at that time. And the sinusitis, or this sneezing and this phlegm and this cough, was had continued for almost 3 months. And then I was using Netipot. I was using, I had turned myself to homeopathy. Nothing really helped me out. So I was totally disappointed. Where am I heading to? So I really wanted to have some idea how can I improve my health and how to improve on my nutrition so that I can take care of well of my family. So I searched for some small newspaper articles, as well as tried normal remedies like trying the beet juices, carrot juices, or whatnot. But it only really, I grew all the more fatigue again and again. So in 2023, this is the final point of my like time, I could say, wherein I had broke my leg. Uh, I think I was 39 years old. So I had broken my right leg. So it was undisplaced fifth metatarsal bone hairline fracture. So through my Chinna Babai, who is in USA, and my church friend, happened to join in this group again. So I tested immediately for my vitamin D, which was only 35. So as you all know, which is the main cause of all these things which were occurring to me. So in from the month of October last year, 2023, I sought the guidance of Uma Prakash Aunty. So still the problem of motions, or the IBS, which had continued. So it embarrassed me many times, and I felt like there is no way out because of this. So but then she suggested me to start the bone soups. I felt really ridiculed. What is this? I'm already going motions like a watery, and then and then she's suggesting these bone soups. I had really no idea at that point of time. So, but then I took I took at her word, started including the bone soups, and I took all the supplements which Uma auntie had shared with me. Then I started to again attend our daily Zoom meetings, which really helped me to understand why I was experiencing all these problems through the various Q&A that happens daily. And when I heard the health sessions, which were like mind blowing and eye opening to a person like me, various of my doubts, various of my it led to me the point where I'm supposed to know a long ago, but then sooner or later I had heard these health sessions which were really uh, led to the point really where how God designed me, and how robust I can be and how healthy I can be, how all these things which I was facing can be reversed. So I changed my diet lifestyle. So how I'm basically I oppose eating ghee. Means it's not that I become fat and all, but I basically I hate ghee. I'm not I used to oppose milk and dairy products or the ghee from my childhood. So because of the counseling or the health sessions, I started including ghee and meats, which were only like a ceremonially once a week. I started them including on a daily basis, and I started to consume 4 to 5 eggs a day, and then included a lot of bone broths in my diet, and introduced the same to my family. So I immediately changed from the iodized pink salt I had literally had thrown away once I have come to know, and I bought pink Himalayan salt and started using coconut and groundnut cold pressed oils. So, and I understand truly that the supplements are really not a mere form of tablets or something, but the supplements are really advised or made for all of us to use, because we really we over the years we missed them in our diet, and then we have to get them anyway. So we have not been included that in our diet. So that is the point, the supplements are helping me in my body. So I started to regularize the supplements, so which really are truly the essential nutrients that are required for my body. I understood through the health sessions what is the leaky gut, what happened really in my gut, and the gut is the main where all the problems had started. When I learned about SIBO, I was really blown away. And then as we all know, there are no instant results anywhere. I just took time and consistently followed and did what all was advised here regularly, and even by hearing health sessions whenever I had doubts. So I back and forth went to the health sessions, and I still continue many times even now to hear the record sessions. So I observed my tooth problems and the ear infection getting resolved on its own once I started correcting my vitamin D levels. And it's been exactly an year that there is no trace of sinusitis. Though recently I happened to clean up my kitchen even without a mask. There is no sneezing, or there is no dust allergy even in seen in me, and the sinusitis had almost vanished by God's grace. So even when I checked my HbA1c levels and fasting insulin in the month of September this year, it was HbA1c was 5.9. But then I started to do the intermittent fasting, so I could get it down. Like previously, I started before September, from the month of May. I can keep, so from the month of May until September, in that short period, so I could see from 5.7 to it came to 5.5. And further, I'm continuing still, so I haven't checked recently. So this is the recent report I have in September. And even so, my weight got reduced from around 3 to 4 because of intermittent fasting. So, so the ultimate point which I would like to stress here is an increased energy levels, which I haven't observed in the past few years. Uh, so So what happened was I'm feeling energy like like how I felt my energy like in my teens, like in my 15s or 20 years. So though I'm 40 now, I'm able to do a lot of chores and run around for my family, as I'm the only daughter-in-law, had to take a lot of things. So there is increased energy level that is observed throughout this 1 year. So it is being really a progressive result that I have been seeing daily. And I owe it to intermittent fasting, which uncle teaches many times in this group. And I have been just on the pink salt water and the collagen for many days. I could stay up with a whole day without feeling any hunger. So there was a natural healing in my leg fracture also, as I learned to correct the root cause of the problem, which is the weaker bones. So I would suggest here that recorded sessions are really important for everyone to hear. We would know really where we really went wrong and what we have been really consuming are wrong, in a wrong way at a wrong time, and what we are really exposed on a daily basis. So everything was clearly explained with scientific side studies and the evidences. So I stress and suggest everyone that we should take time to hear the recorded health sessions. So coming to my family, me and my children, we haven't visited a hospital for a year, even for a small cold or fever. That's really because of God's goodness and the Wellness Springs team. So we have been regularly consuming, me and my children, all this like iodine water, magnesium, K2, supradine, selenium, vitamin B1, vitamin A, and fish oil. So the importance of consuming all these supplements is explained in various sessions. So main change in my diet I did was I reduced carbs to very minimal and increased the protein intake in the form of beefs, mutton, and daily lean protein like chicken. Then started making the dishes out of ghee. So these are the dietary changes which I made, and I'm continuing to do the same. So really, I thank Huma auntie for her guidance, and I thank from the bottom of my heart uh, to Banu uncle for his great testimony and for giving this knowledge to a common person like me, and to be aware of how I should build my health, and even I can be helpful or a blessing to others even around. And even I like to thank Ruth Pavani's sister also, who is guiding my mom at Guntur. She's on her way to recovery. So it's God's goodness alone that has been following us, or His faithfulness towards our family. So I thank you really for this opportunity. And back to you, Prakashanna.
Yeah. Thank you, sister. Yeah, it was really a wonderful testimony and very detailed and very useful testimony to others as well. So now we'll give this time to Dr. Managaru so that we'll continue the health sessions. Yeah, over to you.
Yes. Good morning, everyone. Thanks again for joining, and thank you for all who shared their testimonies. And one thing that is very clear, and is through all these testimonies, is there is an intricate relationship between what we eat and how healthy we are, and that fact cannot be escaped from, and that cannot be denied. That truth cannot be denied. So, thing is, we have gotten used to a certain way of thinking as to thing is, we have presumed and we have taken for granted how our body is designed. See, thing is, we the way our body works is, before getting to that, I would like to say a few things. Because as I mentioned in the beginning of the session, it is extremely, I've been busy, and I have not prepared a formal presentation or anything like that, but I just want to share a few thoughts that come to my mind, um, the few thoughts regarding what has been shared. The thing is, when you experience a condition like polycythemia, or any bone marrow disorder, or um, diabetes, or weak bones, or lack of energy, or autoimmune disorders, or everybody nowadays, they suffer from asthma. The thing is, we are in the modern times, we are characterized by, I think we uh, give ourselves labels like, oh, I'm an asthmatic, okay, I'm a diabetic, or I have kidney issues or kidney problems, or I'm an asthmatic, and I have a I suffer from rheumatoid arthritis, or any number of conditions. What it is, our identity has become, is our sickness has become our identity. Okay, so I think that is, it's fair to say that every one of us, I think, even from our childhood, and the medical science, okay, medicine, that is supposed to keep us healthy. All these disciplines of health that are supposed to keep us healthy have labeled us with our sickness that we are experiencing. Okay, there is nothing that is more what is it, uh, disconcerting than that. The thing is, every one of us becoming identified with our sickness. Okay, so we say, oh, we are, we suffer from depression, and we are. So thing is, if we once we label ourselves with a sickness, any sickness, then what is the reprieve? What is the where do we go? How do we get help? Thing is, the only way we can get help is through taking medication, right? The thing is, once we are labeled with a sickness, and then that becomes our identity, and then we are um, yeah, and we are, once we are defined in such a way, and once we are labeled, and that becomes our identity, and then the drugs, and and drug therapy, and all the clinical um, protocols that are that help a particular condition become attached to that label, and that is how people end up on what is it, drugs for a lifetime. Okay, so how, the thing is, that was not the case not too long ago. Okay, that was not the case even a decade ago, or even about let's say, no, not a decade ago. I would say even 30, 40, 3, 4, 4, 5 decades ago. That was not the case. See, that time, the clinicians used to, they used to strive towards educating people about their sickness, and now all the education that we get is, maybe it is genetic, and there is no explanation for what you're going through, or what we are facing, or once you are a diabetic, it is a progressive disease. Okay, then once you have rheumatoid arthritis, that is a that's a lifelong diagnosis, and that has to be managed by any number of newer medications, or methotrexate, and folic acid, and also the newer monoclonal antibodies, which are targeting certain proteins like TNF alpha and things like that. Okay, is that really the only option? Okay, so when we think about these things, and every one of us nowadays is suffering from gastric distress. Okay? Everyone in the developing world and in the developed world, Okay, almost everyone suffers from gastric distress, and that for that we are told, you take soft diet, and if you take diet that are rich in vegetables, that are rich in plant proteins and plant-based oils, you should be good and you should experience relief. Okay, and with that pronouncement, and people just go forward and eat all kinds of vegetables and overload their systems with compounds like lectins and compounds like oxalates. And what happens is, the very things that are supposed to fix our problem, they become our worst enemy once again. And instead of fixing the problems they're purporting to cure, they're exacerbating the same problems. So that is what we are left with. The thing is, once we are labeled, and after the labeling, comes the dietary changes, and dietary changes that are not beneficial but detrimental. And then that identity is confirmed once again, and also a patient is left with a feeling that they are not doing enough, they are not doing what they are supposed to be doing, and we are lacking, or we should be doing better. And people just go forward and with more and more of the wrong things, and they that identity is confirmed once again, and a person becomes identified with that disease, and that for the rest of their lives. And the drug therapy is we cannot escape from that vicious cycle. So that is what we have seen so far. The thing is, people who are who are okay into their 20s, and then now they suffer from the gut related issues, and diabetes related issues, or bone marrow problems, and uh, um, hyperglycemia, and hyperinsulinemia, and insulin resistance, and diabetes, and so on and so forth, and so on and so forth. So what do we do? Where do we go? And where is the hope? Okay, and we will address one such thing in this, that with respect to gut health. Okay, um, more and more people are getting diagnosed, even children are getting diagnosed with irritable bowel syndrome, IBS, and ulcerative colitis, and Crohn's disease, and all such things. Okay, so where what is the problem? Okay, so the thing is, when Ramya mentioned SIBO and gut related issues, and she went through all the sessions, yeah, and understood, and made these lifestyle changes. Now, within a matter of 1 year, she sees a sea change, and complete change in her health and the way how she feels. Okay? And same thing with the sisters suffering from diabetes, and where she has seen the numbers of her diabetes numbers have went from the fasting glucose numbers went from hundreds, 200s, or 300s, and even 600s to a level that is completely manageable. Not only manageable, they're completely non-diabetic levels. Okay? So how is that possible? So, and her gut health has improved quite a bit. And the Sandeep, who shared with us about his polycythemia, okay, the bone marrow disorder, and where he is having to donate blood by phlebotomy, every 2 to 3 months, and otherwise his hemoglobin levels go up so much that end up being toxic to his liver and various other systems. Okay. So how did we, what did we advise? Did we say, for polycythemia you take this, or for gastric distress you take that? No, did we give any medication? No, that is not what we do. That's not our, that's not our, that we cannot do. That is not that is not the scope of our practice, of our what we do here. It is the prescribing and giving medication is the scope or that is reserved for medical doctors, and we are not doing that here. So we are not treating anything. But the thing is, when people are getting treated for various conditions, changing their diets and changing their lifestyles has a direct impact on how those medications work and how the treatment works also. So this, what we do here in Wellsprings is filling the gaps, okay, in how the modern day diseases are treated. Okay? So if proper nutrition is given, and if the nutritional levels are corrected, if gut health is restored, and if the endothelial layers of the gut and blood vessels are restored, and body overall starts functioning much better as it is supposed to, as it is designed to, that is where our hope is. And that is, the thing is, what we do here is the complementary to what doctors do. So this is not a replacement, but it is a complement. Okay, so that is how we want to understand this platform as. Okay, this platform is here, and this is, we started with what is it, COVID, and in utter hopelessness, bringing hope to many through just dietary supplementation, and also restoring or replacing supplements, replacing the levels of vitamins and vital nutrients in the body. We were able to achieve so much with respect to restoring immune function to the bodies. Okay? So and that is the same, whether it is COVID or any common cold, or whether it is osteoporosis, or whether it is diabetes or polycythemia or any intractable neurological disorder. Thing is, nutritional basis for that disease, once it is understood, then it becomes easier to understand a sickness. And also, once we correct those nutrient levels, your body responds in a way that it is supposed to function. And then, even the medication that you're using works even better and brings about positive changes in your body, and also so much so that your body, may be able to recover to a point where you may not need the medication that you are using. Okay, and we are not the ones to make that judgment call. Let your doctor, after seeing the improvements in you, let your doctor make that judgment call. But the thing is, what we are here to educate or bring focus to is the effect of proper nutrients, and also the power of a properly nourished body. Okay, so from the beginning, we've been saying that it is, and our body is wonderfully, and it's a beautifully designed, and so much so that, the psalmist in Psalm 139 says, I praise you, O God, for I am fearfully and wonderfully made, and wondrous are your works that my soul knows very well. Okay? So this platform stands as a testament to God's wonderful and magnificent and magnanimous and kind design of our bodies, and we will continue to do so. And the thing is, there is a see, in this modern in this day and age, in when our identities are defined by what sickness we are facing, or by our sickness, it becomes so difficult to bring up, just make this message heard, or even let alone, make this message understand, let alone even be heard. Okay, so what we want you to do is to understand how your body functions. Okay, you can do that by listening to the sessions that I have done, about 25 to 30 sessions on every kind of, condition. Not every condition, but most of the things that we suffer from: diabetes or insulin resistance and sarcopenia, muscle loss and neurological disorders, and gallstones and various things. Okay, so and COVID-related issues as well. Okay, now I just want to touch upon with the gut-related issues. So when we talk about the gut-related issues, most of the issues, the immune-related problems also stem from the leaky gut, and that Ramya mentioned just a moment ago. And the reason for the leaky gut and the mechanisms of the leaky gut I have explained in various sessions, and we will cover also in this session as well. Okay, I'm not prepared to address it at any length at this time because I'm, as you can see, as you can hear, I'm working in the lab as I'm speaking. So we will cover those in the days to come. Okay? But I'll just bring attention to one of the issues, and I started by saying that there are even the little kids and younger people are suffering from leaky gut and also the bowel related issues like IBS and IBD and Crohn's disease and ulcerative colitis and all these things. So the reason for that is, in our modern diets and there is a lot there are a lot of there is an influence of agricultural chemicals and like herbicides like glyphosate and various other chemicals that adversely affect our gut health, and that remodel no, these chemicals, agricultural chemicals, and our lifestyles. They remodel our gut bacteria microbiome to an extent where it becomes pathogenic. And the gut related health is extremely important, and the thing is, gut bacteria it always there is a crosstalk between your immune system and your gut bacteria, and so your microbiome becomes an extremely important part of your your body. And that your gut bacteria teaches your immune system how to respond. So even in the immune response your body is able to mount, your gut bacteria plays an extremely important role. Okay, and the reason more and more, most more, and recently, we are there is a lot of emphasis on the fiber. Okay, so we have to consume this much amount of fiber, so you can you can have this your stools can be bulky and they can be eliminated properly and without paying attention whatsoever to the gut related other gut related issues like the strength of the smooth muscle. And if the smooth muscle is not working properly, the thing is you will not be eliminate anything. The thing is, if the smooth muscle is weak and intestinal gut smooth muscle is weak, then what happens is you continue to uh, suffer the way gut works is from the time you ingest food from the mouth to the time it is eliminated. There is this process called peristalsis, which is characterized by these powerful movements of the smooth muscle. Okay, so this peristalsis, if the intestines lack the energy or the strength to move, then this peristalsis will not happen properly. Then what happens is you will when the gut the smooth muscle becomes weaker and weaker and weaker, and then you will end up with conditions called diverticulitis and diverticulosis and all kinds of things that we this muscle will what is it the intestines and they will develop this these pockets called diverticula, and they become infected and it becomes diverticulitis. Okay? So everybody, that we hear nowadays, they have this condition called diverticulitis or diverticulosis. It sounds wonderful, it sounds great, but it is not. It is, it's such a, horrible condition where, you're not able to eliminate all the wastes, and they continue to accumulate in your intestines, and they go into these pockets called diverticula, and they get infected, and you start experiencing a lot of symptoms, and among other among other issues. Okay, so other issues are, you have irritable bowel syndrome, and where your intestines are constantly inflamed, and there is and you have bleeding from when you uh, when you eliminate stools, you have continuous bleeding, and bleeding everywhere in your colon. So these are all the things that you can experience when your gut microbiome is not functioning properly. One of those strains that we are interested in, I think more and more research has been concentrated on a strain called on a strain of bacteria called Akkermansia muciniphila. Akkermansia is very important for our gut health, so much so that it is lacking in people who are suffering from all these conditions. Okay? So inflammatory bowel conditions, IBS. Okay? So, and there is a lot of research lately about how what is it, restoring this Akkermansia to their guts can positively um, impact these conditions, and it can even um, result in complete resolution of symptoms. Okay, I'm not just saying that just by replacing this gut bacteria, you'll miraculously see healing right away. But what I'm saying is, with proper lifestyle changes, with doing all these things, and vitamins and mineral replacement, and nutritionally properly feeding your body and nourishing your body, along with, okay, replacing these keystone strains of this bacteria. One of them is called Akkermansia muciniphila. Okay, that can improve your gut health to a point where you are not you could completely be healed from these conditions. Okay? So I'll just quickly tell you about how this Akkermansia works. Okay, so for Akkermansia to work properly, for your gut to work properly, it is important that your gut muscles have proper strength. Okay, for that you need to, just by putting in more and more fiber in your intestines and in your colon is not going to get your intestinal muscles stronger, but providing your muscles with proper energy and proper building blocks to build the connective tissue. See, thing is, every muscle is built with these proteins, and the the structure that these proteins are latch onto and build upon is another protein structure called this collagen. Okay, so this collagen is the connective tissue which brings integrity to even the smooth muscle. Not all the muscle, it brings integrity to all muscles, but it brings integrity to the smooth muscle as well. So the first thing, if you're having gut issues, if you're having irritable bowel syndrome, if you're having gastric distress, if you're having constipation, if you're having bloody stools, if you're having IBS and intestinal irritation, the first thing that you need to do is provide your body with this, the building blocks for the connective tissue that comes from collagen. Collagen, unfortunately, it is only from animal sources, and it cannot be, there is no vegetarian sources of this collagen. Okay, so that is the first thing, and then then comes the proper proteins. Okay, your protein intake has to be properly corrected, and no, see, none of us get, in Indian context, none of us get enough quality protein in our diets to be able to function in a healthy manner. Okay, so the second thing is you need to incorporate at least 2 grams of protein per kilogram of your body weight. Okay, so 2 grams of protein is what? Where does it come from? The protein. So there is in one egg, the whole egg. So when I say egg, you have to consume the whole egg, including the yellow. Okay, and do not worry about yellow causing your cholesterol levels to increase. And we have covered that in many sessions. But so one whole egg contains 6 grams of protein, and 100 grams of meat contains 27 grams of protein, and even the fish, 100 grams of fish contains 27 grams of protein. Okay, so second thing that you need to do is correct your protein levels, protein intake. Okay, and the third thing you do, see, now that these muscles are stronger and they are able to provide your body with proper peristalsis, peristaltic action. So then now you correct your gut microbiome. Okay, Akkermansia can help, okay, a lot, because Akkermansia produces this mucin layer, that is the mucus in the gut, which protects it from all the contents that are moving through this gut. So that mucus layer, if it is thick and if it is healthy and your body is healthy, and that mucus layer provides a proper medium for this gut microbiome to survive. See, what does gut microbiome do? This Akkermansia, it produces mucin, mucus layer, and that provides the medium for other beneficial bacteria to latch onto and produce these something called short chain fatty acids. Okay, the short chain fatty acid, the butyrate and acetate, and so there are propionate. So these are these are all the short chain fatty acids which are essential for our gut health, for our colon health. Okay, so if anybody is suffering from IBS, in them all these short chain fatty acids production is missing. Okay, because all these keystone strains of bacteria are missing from them. So for that to properly be restored, Akkermansia is the key, the primary primary bacteria that we need to restore. So first of all, you need to provide provide strength to your intestines. How do you do that? By providing collagen, which provides the proper matrix onto which these muscles can build upon. So then give the protein intake, okay, and then restore your gut microbiome by providing Akkermansia, and then eating fermented foods, and slowly you will start seeing a remarkable improvement in how your body feels and how you feel. Okay, so that in a nutshell, how we need to approach, instead of just giving all kinds of anti-inflammatories or combiflams or mesalamines, or any number of drug therapies. First of all, yeah, those things can work, and they can work on a short-term basis, but you cannot be just relying upon these medications for the rest of your life, because those medications only address the symptoms. They do not fix the root cause. Okay, how do you fix the root cause? This is how. Okay, by providing proper strength to your gut, to your intestines, and then restoring the environment in your gut in such a way that this good bacteria can come and colonize and produce all the substances, the mucin by Akkermansia, and all the other the short chain fatty acids by other keystone strains, and we can restore them too. So that is uh, basically, that is in a nutshell how we nutritionally can deal with problems that are intractable, that are unmanageable in modern times. Okay, so I hope you learned something today, and I hope if you have any questions, we'll be able to address those. Let's confine the questions to the topic at hand. Okay. Yeah, back to you, Prakash. Thank you so much.
Yeah, thank you. So, yeah, whatever shared today, so you can ask the questions related to this topic, especially gut-related health. Yeah, you can unmute. Best thing is post your question in the chat. So then later you can ask, unmute and ask the question as well. Personal questions, let us keep it for tomorrow. Okay. Tuesdays, we have a session in English, and Saturdays, we have a session in Telugu. In these 2 days, mostly the questions we will take only on the topics, okay? But other times, you can utilize for your personal questions and clarifications as well, okay? And every day, the meeting will start at 6 o'clock. 6 to 6:30, we have our prayer time. 6:30 to 7, we'll have a testimonies, and after 7, apart from Tuesday and Saturday, we have a question out time. So if Telugu or English, anything is fine, you can ask the question. Okay, you can utilize those days. So anybody have any questions now related to this? Anna, can I understand on the this supplement, right? Acromantia supplement, is it something like a probiotic products
See,
which are available in the market?
No, Akkermansia is a completely new strain of bacteria. It is not available in the probiotics that are that are available. Those probiotics are good also. This lactobacillus and acidophilus and all those things, they are good. But Akkermansia, if it is missing, I think you will benefit from supplementing with Akkermansia mucinifer.
Okay, and how much we can take, on the
See, it is
quantity wise and yeah.
Yeah, Akkermansia that we suggest is from Pendulum Therapeutics. It is 1 capsule, Akkermansia, so one capsule daily. And as long as you start doing other things, like other things that we suggested, and by improving the gut health, once you restore Akkermansia to your gut, you may not need it after probably 6 months or 6 or 7 months. Okay? So after that, your gut will be colonized by this bacteria, and you should be able to. Means once you provide a proper home for this bacteria, that bacteria should colonize and start reproducing. So you may not need it for probably more than a year, depending on how dysfunctional your gut is.
Okay, thank you. Yeah, so Satish Chella. Okay, I think I have not given option to unmute. Yeah, now related to this topic, you want to ask, can unmute and ask the question. Okay, brother Satish. We'll go by those who have raised the hands. And when we call your name, please be available. Otherwise, I'll.
Sir, good morning, sir.
Okay. Yeah.
సార్ నేను తెలుగులో మాట్లాడొచ్చా సార్?
Yeah. Please go ahead.
గట్ హెల్త్ కి సంబంధించిన ఇష్యూనే సార్ నాది.
Prakash, why don't you translate also, please? Okay.
Yeah, sure. Yeah, brother, go ahead.
సార్ ఓకే సార్, నేను 11 months గా మన గ్రూప్ లో ఉంటున్నాను సార్.
Okay.
Yeah, go ahead.
బట్ సార్ నేను రాజశేఖర్ సార్ గారి గైడెన్స్ లో ఉంటున్నాను సార్ నేను. కానీ నాకు కొన్ని రోజులుగా ఒక 6 months నుండి నాకు ఈ ఇంటెస్టినల్ వార్మ్స్ అనేటివి ఇంప్రూవ్ అవుతున్నాయి సార్. అవి మామూలుగా నేను బ్యాండీ ప్లస్ అని ఇవన్నీ ఏం తీసుకున్నా కూడా అసలు డౌన్ఫాల్ కావట్లేదు సార్. అసలు పెరుగుతూనే ఉంటున్నాయి సార్. అక్కడికి ట్రై చేద్దామని చెప్పి ఒకసారి డాక్టర్ దగ్గరికి వెళ్తే ఆయన ఎండోస్కోపీ సజెస్ట్ చేశాడు సార్. సజెస్ట్ చేస్తే లేదు సార్ నాకు వద్దని నేను 1 or 2 times నేను చెప్పాను. కానీ బట్ నాకు బాగా తెలిసిన వాళ్ళు లేదు చూద్దామని చెప్పేసి వాళ్ళు ఒకసారి ఎండోస్కోపీ చేశారు సార్. నాకు చేసి లోపలైతే ఎటువంటి ఇష్యూ లేదు, నీకు చాలా బాగుంది, బట్ అది ఎక్కడి నుంచి వస్తున్నాయి అనేది ఆయన చెప్పలేకపోయాడు సార్ నాకు. ఆ విషయం ఏం కాదు, ఈ బ్యాండీ ప్లస్ వాడేసే అన్నాడు. వాడి ఒక 1 week, ఒక 2-3 days అట్లా వీక్లీ ట్వైస్ అట్లా వేసుకోమన్నాడు సార్. ఒక 3 weeks తర్వాత మానేమన్నాడు సార్. ఇంకా నేను వెళ్ళలేదు సార్ హాస్పిటల్కి, పోలేదు, నాకు వెళ్ళలేదు సార్. నీకు రాజశేఖర్ సార్ని అడిగితేనేమో సారు ఒకసారి సార్తో డిస్కస్ చేద్దామమ్మా అని చెప్పేసి ఈరోజు ఎలాగో గట్ హెల్త్ గురించే కదా అని చెప్పేసి నేను హ్యాండ్ రైజ్ చేయడం జరిగింది.
Okay, Prakash, you want to translate? I think this is very important.
Yes. So Satish is suffering with gut-related issue. So major issue is like in his intestines, the swarms are actually getting growing. So after endoscopy and so they found like gut is healthy, but from where actually these worms are getting grow, they don't have any clue. So that is the reason that he approached Bhanu Garu, and yeah, he want to
Okay.
understand where exactly the problem. Yeah.
Okay. Understood. So, Satish, do you understand English?
Sir, I understand, sir. I can understand, but I cannot
Okay.
speak, sir.
Okay. Wonderful. That's fine. Okay. Okay. This is, I think, intestinal parasite is a major issue. And among in developing nations and also even developed nations, that intestinal parasites is a major issue. Okay? So, and nowadays, just taking parasitic agents, okay, that can, probably seemingly help for a little while, but overall, it's as you have already found out, it is no help at all. So these, when you start taking these, antiparasitic drugs, they will help for a little while, and but these worms still, they keep on appearing, uh, to your surprise and to your disappointment, right? So then, how do we deal with it? Okay, so what I want to say is, in your if your gut is dysfunctional, if your gut is not healthy, there is a reason why these parasites are there. Okay, so when you see these parasites, when you these worms, and just though as disgusting as it is, elimination of those at any cost should not be. It won't be successful. Just taking antiparasitic drugs will not result in getting rid of them at all. Okay. Yeah, sometimes you can see them. As soon as you take the antiparasitic drugs, they can come out at a. But you will, and they will keep on. I think coming as you stop those drugs. Okay. So, as I said just a moment ago, that there is a reason why these parasites are coming. The reason is, your gut is providing a wonderful home, means a wonderful home, a wonderful habitat for them to grow. Okay, so that means there is a there is a uh, dysfunction that is predisposing your gut to be inhabited by these parasites. So at some level, there is gut dysfunction that is helping these parasites to set up their home in your gut. Okay, so these are, most of the time, these are, unless you have huge tapeworms growing in you, these are harmless, but they are not completely healthy. Okay, so for that, what you need to do is, how long have you been following our dietary guidelines?
Sir,
ఎప్పటి నుంచి మీరు follow అవుతున్నారు?
6 months, sir. 6 months
Okay,
నుండి
you've been
follow
following
అవుతున్నాను.
for 6 months. Okay, have you experienced any betterment or any improvement through this
సో
through these 6 months?
చాలా బాగా సార్, ఆల్మోస్ట్ అన్ని ఇంప్రూవ్మెంట్ ఉన్నాయి సార్, నాకు ఇది ఒక్కటి తప్ప.
Okay, okay. So, did you notice these parasites even prior to coming onto our diet?
అర్థం కాదు.
Anna, small, Satish, 1 minute. Anna, previously he used some psychiatric drugs for psychiatric treatment. The doctor
Mhm.
misjudged him, and doctor is given some psychiatric drugs also. But after following
Okay.
our diet and our supplements, he became
Mm.
better, and now he is in sound position.
So he is not using that psychiatric medications
Yes,
anymore.
not at all, not at all.
Okay, okay, all right. So prior to using this, prior to 6 months ago, did you see these parasites to the same level as you are seeing now? ఇంతకు ముందు, ఇది వాడకన్నా ముందు చూసారా, అంటే ఈ 6 నెలల కంటే ముందు ఈ పారాసైట్లను మీరు చూసారా, ఈ వర్మ్స్ మీరు చూసారా?
చూసాను సార్, అడపా చూసాను సార్, కంటిన్యూగా చూడలేదు సార్.
Okay, అంటే ఇంత ఎక్కువ లేవు, అదే కదా?
లేవు సార్, అస్సలు లేవు.
ఓకే, సో ఈ డయట్ మీదకి వచ్చిన తర్వాత వాట్ యూఆర్ ఎక్స్పీరియన్సింగ్ ఇస్ దెర్ ఇస్ అన్ ఇంక్రీస్డ్ elimination of these worms from your gut after you started correcting this, correct?
Yes, sir.
Okay, so that's a good thing. So that is exactly, that proves my point. So prior to that, you provided a good, wonderful habitat for them to grow, and they are staying, their content staying inside. Okay? But now, you started improving your diet and you started improving your health. See, that is not, that is an unpleasant environment for those worms, and now they are, you are seeing more and more of them come out. So my guess is, as you go on improving your health, I think this incidence of these worms will go away probably in a month or two, or probably in another 6 months. Okay, so let's continue to follow this. Okay, let's continue to follow this. And if you want to use these antiparasitic medications, you can use those. But I think your body is getting rid of them.
Okay, sir.
Okay.
Okay, thank you.
Thank you.
Okay.
He's following strictly low carb diet, completely low carb diet. Only
Okay,
will take,
wonderful. Yeah, that's good. And also improving your microbiome, that would help also. And we will talk. Go ahead.
సార్, ఒకప్పుడు నేను హెల్త్ బాగుంటే చాలా అనుకునే స్టేజ్ నుంచి ఇప్పుడు నేను బాడీ బిల్డింగ్ వరకు స్టార్ట్ చేశాను సార్.
వండర్ఫుల్, వెరీ గుడ్, ఐఎమ్ గ్లాడ్.
అసలు బతికితే చాలా అనుకున్న పరిస్థితి నుండి నేను ఈ సెషన్స్ వినటం వల్ల, నేను ఈ డయట్ చేయటం వల్ల ఆఖరికి నా హెల్త్ అంతా బాగైపోయి ఇప్పుడు నేను జిమ్ వర్కౌట్స్ చేస్తున్నాను సార్. ప్రస్తుతానికి మన ప్రోటీన్ ఎలాగో ఎక్కువ తీసుకున్నాను కదా అని చెప్పేసి నేను ఈ బాడీ బిల్డింగ్ వర్కౌట్ లో ఉంటున్నాను సార్ ఇప్పుడు ప్రస్తుతానికి. బట్ వెయిట్ పెరగట్లేదు సార్, అది బాధ. ఇంకా అంతకు మించి అయితే.
All right, we will talk about this later. Okay, we'll talk about this later. Thank you.
Thanks. Right.
Okay.
Okay, Prakash, go ahead.
Shivaji garu. Okay. Sureka.
ప్రైజ్ లార్డ్ బ్రదర్.
Yeah.
అదే 2 days బ్యాక్ నేను బ్రెస్ట్ క్యాన్సర్ అని చెప్పాను కదా బ్రదర్. దాని గురించి టెస్టులు చేయించుకోమన్నారు. ఇన్సులిన్ ఫాస్టింగ్ ఏమో 11.46 ఉంది, విటమిన్ డి 59.99 ఉంది, HbA1c 5.3 ఉంది బ్రదర్. ఈ రోజు పెట్ టెస్ట్ కోసం రమ్మన్నారు బ్రదర్ ఇప్పుడు 8:30కి. చిన్నబాబు డాక్టర్ ఇన్ యశోద హాస్పిటల్, హైదరాబాద్.
ఓకే ఓకే, వండర్ఫుల్ అమ్మా, గో అహెడ్. యా, దాన్ని వెళ్ళండి, వెళ్ళి
అది అంటే గైడెన్స్ కోసం అడుగుతున్నాను.
తప్పకుండా, దట్స్ ఓకే. పెట్ స్కాన్ రిజల్ట్, లెట్ ద పెట్ స్కాన్ రిజల్ట్ కమ్ అండ్ we will please forward that to us and we'll go from there. Just go for the PET scan. And also, have you been taking vitamin D prior to this?
Prior to this, I have taken vitamin D. Previously, it was like 9. Previously, it was like 9. Now it gone to 59.99.
And how long have you been taking this?
Almost 2 months, weekly once.
Okay. Wonderful. Okay, so yeah, just let
I joined this,
go ahead.
I joined the CRT only 2 days back, brother. So I still am not using the which you have provided the guidance.
Okay.
Indra madam told
that's okay.
today.
That's okay, ma. That's okay. Why don't you go to the PET scan? Okay. And your son is a doctor in Yashoda?
Yes, Chinnababu doctor.
Oh, Dr. Chinnababu. Okay, Dr. Chinnababu. Yes. Okay. Yeah. Go ahead and get the test done, and we'll talk about it after you get the result.
Thank you, brother. Thank you, doctor.
Yeah. Savita Satyapal. Satya.
Hello, sir.
Yeah.
Sorry, this is about my husband. He's putting my baby to sleep, so that's why I'm talking. Sir, he started having rectum bleeding since the month of March, So the diagnosis totally got deviated to hemorrhoids. So that's when we usually stay in Germany. So that's when we visited to India and we stayed there for a few months, where he was totally okay over there. After coming here since the month of August until now, he's having rectum bleeding. He got diagnosed with ulcerative colitis in the month of August, and he started taking Sofolac 3 grams, but there is no control over it. And we started listening to your sessions just a month ago, and we started taking D vitamin thrice a day. We just spoke to Mr. Prakash Elliott, and that's when we came to know that we can take thrice a day. After that, Ruth Pavni Garu, she guided us to Dr. Tirupati to talk to him. That's when my husband spoke to him. He he asked us to take D vitamin every hour, but under the guidance of someone. So we are waiting for someone's guidance if it's okay to take.
How long has he been taking this 3 times a day?
8 days, because we don't get
For 8 days.
50,000 IU supplements a year.
Okay.
So we must get it from USA or from India. So it is easy for us to get from USA. That's why it took a lot of time for us to get the supplements.
Okay. So you are in Germany currently, correct?
Yes, sir.
Okay. Did you notice any difference since you started taking it 3 times a day? Since he started taking it 3 times a day?
No, not exactly. No.
Okay.
Because his D vitamins are very low. It was 17.
Okay. And what other changes has he done, if any?
Just he started doing intermittent fasting, and then taking meat. The problem here is that we don't get mutton or here, only chicken, and fish. That's all. We have a 10 months old baby, and only we both have to manage her. And even I have many other problems. So to maintain this diet is really tough. So half of the day he eats these vegetables, and the other day, and the other half he takes the meat.
Okay. What is his weight?
He's underweight person, like 56, where he's 5'8" height and 56 kgs weight. Now he got reduced to 50.
And since how long has he been? When was he diagnosed with IBS?
No, IBD. So it's
IBD,
in the month of
irritable bowel
August.
disease. Yeah.
Yes. No,
Okay.
no, inflammatory bowel disease. It's in the month of
IBD.
August.
Okay. And prior to that, how long has he had the symptoms?
Since March.
Okay.
March of this year.
So he has not experienced those symptoms ever before. March was the first time.
Yes.
Okay. All right. So you spoke to Ruth Pavani's sister already?
No, through her we spoke to Dr. Tirupati.
Dr. Tirupati. Okay.
Yes.
Okay.
He also asked us to take Akkermansia, but under the guidance of someone, because he said his case was so it was so severe for him, and that's why he said he was asked to take Akkermansia.
Okay.
But
okay. How long has he taken so far? 1 week, you said, right?
Yes, sir. 1 week.
Okay. So Dr. Tirupati and Sister Ruth Pavani, they have your details, correct?
No. We just spoke to them. No other details were given to them.
Okay.
The main
Did you share your
problem is that
Did you share your contact information with them?
no, sir. Because it was just a chat. So we just
why so do you have access to WhatsApp?
Yes, sir. I'm part of Wellsprings 4.
Okay. All right. Wonderful. So why don't you send a message to Sister Ruth Pavani, okay? And you would send all the whatever test results and details that you have. Send
Sure,
it
sir.
to her. Okay.
The diagnosis the diagnosis
Mhm.
over here is very slow because in the month of August, when he got diagnosed with UC, until now they did not perform this colonoscopy. And
Right.
without performing the colonoscopy, they have given all the medication.
Yeah.
And right now, my family doctor suspects inflammation in other parts of the colon as well, not just in the rectum. So we are
Yeah.
planning to have a colonoscopy very soon, but we did not get the appointment until now.
That's okay. Colonoscopy only proves what is already obvious. Okay.
Yes, yeah.
So we don't need to wait for the colonoscopy to incorporate the changes that are essential. And you say here, following the diet is very difficult in Germany,
Yes, sir.
and it should be it should be the other way around. So we'll see. We'll talk. And in the meantime, just share your details, and I'll be in touch with you.
Sure, sir. Sir, just one short question. My mother is suffering from gallbladder stones, and the doctor asked her to remove the gallbladder.
Yeah. How
And
old is
her
she?
gallbladder got she's 63, and the gallbladder got shrinked so much. They obviously said it's a side effect of the steroids used during the COVID infection.
Mm-hmm.
So right now, I heard that other testimony related to gallbladder. That's what we are following right now.
Okay, that's fine. Just follow that as well. So for gallbladder, taking out the gallbladder is not the solution for that.
Yes, I heard.
Yeah, gallstones can be addressed with proper diet and lifestyle changes.
Okay, sir.
Okay.
Okay, sir. Thank you.
Thank you.
Yeah. So SISU 2029. So it's better to put your names. Sometimes it's difficult. So for Sai.
Hello, sir.
Yeah.
Sir, I had some viral fever.
Go ahead, brother.
Sir, I had some viral fever like 2 months back. And after that, I started having these joint pains, severe joint pains. I'm not able to walk also sometimes. And my doctor told me that, it is post-viral arthralgia, but I don't know that scientific term. But he's given me that term, and he told me that it is actually going to go away all by itself in a month or two. But it is very difficult for me to go out and also go to work, and this is actually causing a lot of difficulty in my day-to-day affairs. So and my vitamin D3 is also I wouldn't say very low, but it is, when I did the test, it is 26.3. So one sister from my church recommended me to attend this session. So that is why I'm here today. I just wanted to understand if there's any remedy.
This is your first time joining, right?
Yes, sir. Yes, sir. The first day, I would say.
Okay. Prakash, you want to?
Yeah, yes, Anna. So, what we'll do is I'll share the WhatsApp link in the chat. So please join the group. Even those who joined for the first time, if you're not there in the WhatsApp group, so please join. So any one group is fine, so that you will get all the links and details. And meanwhile, you can get your vitamin D levels tested. So
No, he already did. So it is
already
29. So okay.
okay.
So yeah, when he
Then put
shares his
your
information, yeah.
yeah, put your number and name and your issue in the chat, brother. I think someone will guide you. Okay.
Yeah, thank you, sir. I'll do that.
Yeah.
Thank you very much.
Yeah, please try to join these morning, sessions
Day.
and listen to the testimonies, because that gives the
Yeah.
confidence and clarity. Okay.
Yes, sir. The word of
Yeah.
God is also very important, more than this.
Okay.
Thank you.
Sai. I think no, we'll take few questions from chat.
Okay, please do.
So, yeah. So one is like, when is the right time to use acromantia suffering from UC? Yeah, Sister Priya, you can unmute and ask because this is something related to your problem.
Sir, I just spoke to
Acha, you're the one. Okay, right, got it.
yeah.
Yeah, thank you.
Yeah, thank you.
So, and there is one more question. My uncle suffering from liver cirrhosis with cancer. So, doctors told that he got liver failure. So, he was imbalanced in sugar levels and sodium levels. He is not taking any medicine for sugar. So, we discussed last time with Dr. Vitamin D3. Okay. Okay, I think Sister Shiny, you can ask tomorrow directly this question. Let's see. So Anna, we suggested like a vitamin D3 injection. So today is the third day, and these days he has a fever, swelling on leg, and stomach pain. Sugar level also fluctuating on the border in fasting and after fasting.
And who is guiding them?
Mr. Shiny, you're there? Shiny. Maybe she asked the question in the morning session, it looks like. So, vitamin D level is 6.8.
Okay, I think somebody probably guided her, so I think we need
Yeah,
to know whose guidance she is under. If not, we can address this tomorrow morning.
yeah. Is migraine and gastric issues related?
Absolutely, they are. Absolutely. Yeah, we will. Yeah, I think if
How
there are
can
any specifics, yeah, go.
How
Yeah,
can
go
we
ahead.
understand the symptoms that we have leaky gut, or through the what test can we know that we have leaky gut?
Well, if you're having symptoms like your simple immune reactions, or eczema, or migraines, or just diffuse pains, or your sleeplessness, and fibromyalgia, or any number of these conditions, will point to insufficiency and gut-related issues. So it's not like there is. I don't think there is any particular test per se, but with all these symptoms that are not getting better with treatment, that is when this is a diagnosis of the elimination and the diagnosis by all the other symptoms that you have.
Yeah. Can people with a normal gut take Akkermansia supplements, or is it only advisable if someone have suffering from IBS or leaky gut?
You can take even I think people can benefit from taking Akkermansia.
Okay. So is Pendulum brand available in India market? Okay.
In Indian market, it is not available. It is in short supply even here, and it's the only problem is that it's very expensive. So
Very expensive, yeah. Yep. So I mean, in this scenario, right, Anna, like as we are actually, having you suggested collagen and protein, proper protein intake. So that also will, helpful in, recovering from this leaky gut issue.
definitely. The thing is,
Yeah.
that is the reason why the Akkermansia is not the first thing that I suggested.
Yeah.
First of all, if there is weakness in the smooth muscles of the intestine, that is that could be the problem. And once you fix those, most of the problems might be, you may be able to resolve most of the issues right there.
Yeah. Yeah. So yeah, I think yeah, all you can understand, right? So this is where actually even so when Bhanugar is talking, so the first place we talked about the collagen and protein intake, so and dementia. So yeah, as you know, it's a little costly, but if you are able to afford, and that will be very useful, which you can take. Okay. And yeah, next one is uh, yeah, I think these questions are done. So now, Saigar.
Hey, hi. Good morning.
I think we have no less time, so only three questions: Sai Garu, Nagrid Garu, and Ram Prasad. Okay,
Yeah.
so only
And
three questions. Yeah, go
yeah,
ahead.
good morning. My mother, she is diagnosed with thyroid cancer. Initially, we thought like it's a thyroid issue, but somehow after she had some one operation for thyroid, and they figure out like there is a cyst inside the thyroid. So they have given like a couple of chemos in the CMC, and initially it was a low grade, but now it's developing. So in last week I joined, and I have informed like this is the issue, and the team said like they will contact me, but I'm still waiting on them to contact. So
Okay. So where is your mom right now? Is she?
she is at my home only. I'm from United States, but she is from India.
Okay, she is in the US right now?
No, she is in India.
Okay, she's in India. You are in the US?
Yep. I'm in the
Okay.
US, and I have shared
Okay.
my father's number in the chat.
Right. Okay. And what treatment plan is she under? What are the
For like 3